meal plan, enjoy all kinds of foods, but we just need to be well educated on what foods are good to eat.
Very good. Ms. Boren, I think you mentioned earlier that you've been involved with this since you were 3 years old, which is to say that at a very early age, your diabetes was detected. Let's talk about living with diabetes.
Okay.
You've been involved for many, many years, since the age of 3. And what can you tell our audience this morning about simply living with it? I mean, give us sort of a day-to-day, sort of a sketch in terms of what you have to do as a person who is aware that you have diabetes.
I guess the hardest thing for me to define is the way I live my life is not the same way that other people with diabetes will live their life. And I guess I should say that on the front end, because I've been fortunate through my life. I've had the best of care since I was first diagnosed. And the reason I was diagnosed is that my dad's sister had diabetes, and both of my grandfathers. And they noticed that I had lost weight and thirsty all the time.
This was at 3 years old?
At 3, yeah. And I had these little bumps on my arms. And my dad said, well, you know, Sis had those when she was young. And so they started looking through the medical books. And I used to come in their room and say, I just don't feel good. And of course, a 3-year-old can't tell you where they don't feel good. So they took me in and they diagnosed me immediately, and which was fortunate. A lot of people, it gets to a point where they're either in coma or their blood sugar is so outrageous, I mean, it takes a long time to get it back in sync. So I was very fortunate. I do have type 1 diabetes, which means that my body produces absolutely no insulin, and will not.
So all your insulin has to be taken from outside?
It's taken artificially, and if my purse were down here, I'd show you. I carry it with me, and I'm on a method that they call intensive insulin therapy. She was talking about the DCCT study, and what that really, and when I talk in lay terms, if that's okay,
do that.
The DCCT study was divided really into 2 different groups, and you tell me if I'm doing this wrong, please. There was group 1 who was under the old method, okay, and that's what the majority of the population's on. I take 2 shots a day, and my doctor tells me what to take, and I go see him, and I'm very restricted.
You take 2 shots a day?
No, I don't. But I'm saying that's where the majority of the population is that has diabetes and is totally insulin dependent.
Okay, very good.
And they have to eat their meals at set times. I mean, very limiting. Because, Dr. Haney, your body is producing insulin, and it's producing it 24 hours a day in accordance with your emotions, food, exercise, stress, whatever's going on. And I would imagine that it's working good right now, because you've probably been up for a while since it's 6:30 in the morning right now. But the other group is the type that are on intensive insulin therapy. And that means that they are either on an insulin pump. You may have heard of some people, it's real little, it's about the size of a beeper, and it will put out insulin in a little stream 24 hours a day, kind of like what your body's doing, okay? So you can act more normal, okay?
With the pump?
With the pump. With the pump, you're controlling it, and the diabetes is not controlling you, if that makes sense. I'm on a step down from that, and that is that I test my blood sugar anywhere from 4 to 6 times a day. And according to what the blood sugar readings are and what I'm about to do, if I'm going to eat or if I'm going to exercise, will determine how much insulin that I take. But that allows me to know what's going on more often during the day. The results of that trial said, and you may give me the percentages, that second group that was doing the intensive, trying to make their body act more like yours, the complications were reduced by up to 70%. Was that correct? And that's an amazing thing to think about. So as a result of that, you know, boy, it's even more important that we get the doctors educated and get them all on the program so that they are diagnosing it correctly on the front end. But that's what that is. And that's why I'm saying it's kind of hard for me to say I live my diabetes life this way, because they're all different spectrums. But I've been very fortunate. I've got good genes, and I've had a very supportive family who has said, it's up to you. If you want to do it, go do it. And there has been no protection. There are a lot of individuals who, as they're growing up, are protected. Honey, you can't do this because. But there are times when I have found that, yes, it's a hassle. I don't want, you know, I'm tired of going to the pharmacy and buying that stuff. And it's expensive. And there are times I'd like to just be able to go do what I want when I want. But, you know, I do have to remind myself to stop and do those things. Now granted, and a policeman may not like hearing this, but I'll test my blood sugar when I'm driving down the expressway. Just because I don't want to stop.
You have to do it about 4 or 5 times a day.
It depends on the day, but I kind of like to know what's happening. I like to know what's happening all the time because, you know, I certainly don't want to go to the doctor and be faced with that fact that, Dudley, you're losing your eyesight, or Dudley, we're seeing problems with your kidneys. I just don't want to get to that point. I've seen it too many times. I look at people that I went to camp with that have had double transplants, i.e. pancreas and kidney, and have not survived. I've seen folks that have gone blind. I've seen folks that at age 34 have had bypass surgery, open heart surgery, and there are a lot of those situations where people don't realize that it's diabetes. They think he had a heart attack, but many of those cases it's a byproduct of yeah.
You know, Ms. Smith, I think she's indicated that this is a disease that requires quite a bit of discipline on the part of the person who might be affected by it. What are some of the things that you can tell our audience in reference to that?
We're talking about lifestyle changes. As Dudley alluded to, most of us, if we don't have time to eat at lunch, we just go on and we'll catch something at 2, or we'll catch something whenever, or if we don't get anything till dinner time, we manage, okay. We're talking about someone that, I don't want to use the word regimented because it doesn't have to be regimented, but we do have to have a discipline in the fact that I do need to